Chapter 5. Hospital Stay. My hospital stay, bariatric surgery. What do I do before coming to the hospital? Know your medicines. If you are on a blood thinner or aspirin, talk to your surgeon about when to stop this medicine before surgery. If you take birth control or oral contraceptives or estrogen replacement, you should stop taking it at least 2 weeks before surgery through 4 weeks after surgery. You should use another birth control method if this applies. Talk to your doctor about this. The pre-admission testing department will instruct you on what medicine to take the day of surgery. If instructed to take medicine the day of surgery, take medicine with a sip of water only. Read the same-day surgery brochure given to you at pre-admission testing or during the pre-op education class. Shower the night before and the morning of your surgery as directed by the pre-op showering instructions for surgery patients, form also in this chapter. Drink your pre-surgery nutritional drink as instructed in Chapter 3 and reviewed during your pre-op education class. If you are using CPAP, bring your machine, mask, and solution to the hospital with you. What happens upon arrival to the hospital? You will be directed to the pre-surgery area. An IV intravenous will be started to give you fluids. You will be weighed and must weigh at or below the weight your surgeon discussed with you. Several medications will be given to you with a small sip of water and a patch placed behind your ear. You will be taught how to use an incentive spirometer to help expand your lungs. Personal belongings will be given to your family or be delivered to your room once it is assigned. Questions about allergies, anxiety, history, name, birthday, and surgical procedure will be reviewed with you. This is a system of double checks and you will be asked multiple times by several staff members. Your family will be able to stay with you until you are ready to go to the OR, at which time they will be directed to the waiting room. The nurse will inject a blood thinner into your belly to prevent blood clots. What happens in the holding room and operating room? You will meet operating room OR staff, anesthesiologist, and nurse anesthetist in the holding room. You will be asked many questions again. You may receive medicine in the holding room before you ride to the OR. This will help you relax and you may not remember moving to the OR. Compression boots will be placed on your lower legs. These are sleeves that wrap around your lower legs that will gently squeeze and release your leg intermittently. These sleeves will help with circulating your blood and help prevent blood clots. Multiple safety straps will be placed and secure you when you are on the OR table. It may be cold in the OR, but you will be kept warm with blankets and a warmer. You will go to the recovery room or post-anesthesia care unit, PACU, after your surgery. Here your heart rate, breathing, and blood pressure will be monitored closely. What happens on the bariatric surgery unit? You will have to ask for pain medications as needed. Therefore, you must let your nurse know if you have pain so he or she can give you medicine. You will be given pain meds by IV until you are sipping liquids. Once you can sip liquids, you will be given oral pain medications. Compression boots must remain on your lower legs while you are in bed or sitting in the chair. They can be removed only to walk in the halls or go to the bathroom. The first time you walk to the bathroom, you will need help. You most likely will not have a catheter or tube in your bladder to drain your urine or be given a bedpan. Remember, walking helps relieve gas pain. Get out of bed and sit up as soon as possible. Bring a small pillow to splint or hold in your incision. What role do I play during my hospital admission? Use your incentive spirometer 10 times every hour while you are awake. You will use this at home for 7 days after discharge. You must walk the halls as soon as you can. This will help get rid of the gas pain. We will accompany you upon discharge walking to your car. Your Stage 1 diet. You will need to measure your fluids in small 1-ounce, 30 cc plastic cups. These will be given to you in the hospital. 1. You will sip 1 ounce over 15 minutes. No gulping, no guzzling. 2. You will monitor and keep track on your flow sheet. 3. All fluids will be sugar-free. 4. No straws. 5. No carbonation. 6. 48 to 64 ounces, 1.5 to 2 liters of fluid a day. Patient bariatric fluid log. Place an X over a cup for every 1 ounce you finish drinking. Bariatric clear diet. Sip slowly throughout the day, drinking 48 to 64 ounces per day. Do not drink an entire 1 ounce at once. Each 1 ounce should take several sips. My procedure, my body. Roux-en-Y gastric bypass. What happens during the surgical procedure? 5 to 6 tiny incisions or cuts are made. The larger of these incisions may cause discomfort for several weeks. Your belly is filled with gas to create a space for your surgeon to operate. Some gas may remain after surgery and could cause pain in your chest or abdomen. A slim tube called a laparoscope is placed into one of the incisions. The laparoscope is connected to a camera which shows the inside of your belly on a TV screen for the surgeon to see. Special tools are placed into the other incisions by the surgeon to help with the operation. Fluid is used to irrigate and rinse the area. Some fluids may remain and you may leak a little from the incision sites during the first day or two after surgery. This is normal. What changes happen to my body? A small pouch is made from the upper part of your stomach. The pouch is about the size of an egg. You will lose weight because you will eat very little. Losing weight this way is called restriction. The small bowel is cut 18 inches below the stomach and is attached to the smaller new pouch. Where the small bowel meets the new pouch, a new opening or stoma is made. This new connection is called an anastomosis. The opening is about the size of a dime and is why you need to take small bites and chew very well. The rest of your stomach is not removed and will continue to make gastric enzymes or juices. These enzymes will meet up with the food in the intestine where your doctor makes another anastomosis. Your larger stomach has a valve, pyloric sphincter, at the end of it to regulate food going into the small bowel. After surgery, this sphincter is bypassed and food is able to slide from the pouch into the small bowel without resistance. This is why the 30-60 minute rule must be followed. Food will bypass a large portion of your stomach and the upper portion of your small bowel, the duodenum. Bypassing these areas will decrease the amount of calories and nutrients absorbed. This is one of the reasons for rapid weight loss and why you must take vitamins and minerals for life. All anastomoses are made with titanium staples, which mean that you may have MRIs or go through metal detectors without a problem. Why isn't my gallbladder removed? Adding a procedure makes your surgery and anesthesia last longer. The incision used for gastric bypass are not in the best place to remove your gallbladder. Leaking from the gallbladder site is not as serious as leaking from a gastric bypass anastomosis, although you might have similar symptoms. The doctor could have a hard time knowing which problem was causing your symptoms. Your hospital stay could be longer. Only 30% of gastric bypass patients will develop gallstones. Will I need a drain? A drain may need to be placed but happens rarely. If you have a drain, it will be removed before discharge from the hospital or at your first follow-up appointment. My procedure, my body. Laparoscopic sleeve gastrectomy. What happens during the surgical procedure? 5 to 6 tiny incisions or cuts are made. The larger of these incisions may cause discomfort for several weeks. Your belly is filled with gas to create a space for your surgeon to operate. Some gas may remain after surgery and could cause pain in your chest or abdomen. A slim tube called a laparoscope is placed into one of the incisions. The laparoscope is connected to a camera which shows the inside of your belly on a TV screen for the surgeon to see. Special tools are placed into the other incisions by the surgeon to help with the operation. Fluid is used to irrigate and rinse the area. Some fluids may remain and you may leak a little from the incision sites during the first day or two after surgery. This is normal. What changes happen to my body? The stomach is made much smaller by stapling and separating the stomach long ways, making the new tube-like stomach approximately the size and shape of a banana. The size will be approximately 3 ounces in volume. The remaining stomach, approximately 80 to 85% of your original size, is removed after the stapling and separation. All the nerves and functions of the stomach, including the valve at the end, remain intact. Weight is lost due to the drastic restriction in size of the stomach and the amount of food that can be eaten at one sitting. This procedure does not involve bypassing the small bowel. This procedure is not reversible as the remnant stomach is removed. The part of the stomach that is removed is the part that stretches the most. The remaining tube-like stomach is the part that is most unlikely to expand and is more resistant to larger food volumes. The longer and thinner the tube, the more resistance there is. This is what makes this procedure work. You will feel full after very little food. The staples are made of titanium, which means that you may have MRIs or go through metal detectors without a problem. Why isn't my gallbladder removed? Adding a procedure makes your surgery and anesthesia last longer. The incision used for gastric bypass are not in the best place to remove your gallbladder. Leaking from the gallbladder site is not as serious as leaking from the staple lines along your new stomach, although you might have similar symptoms. The doctor could have a hard time knowing which problem was causing your symptoms. Your hospital stay could be longer. Only 30% of bariatric surgery patients will develop gallstones. Will I need a drain? A drain may need to be placed. If you have a drain, it will be removed before discharge from the hospital or at your first follow-up appointment. My procedure, my body. Laparoscopic biliopancreatic diversion, BPD. What happens during the surgical procedure? 5 to 6 tiny incisions or cuts are made. The larger of these incisions may cause discomfort for several weeks. A slim tube called a laparoscope is placed into one of the incisions. The laparoscope is connected to a camera which shows the inside of your belly on a TV screen for the surgeon to see. Special tools are placed into the other incisions by the surgeon to help with the operation. Your belly is filled with gas to create a space for your surgeon to operate. Some gas may remain after surgery and could cause pain in your chest or abdomen. Fluid is used to irrigate and rinse the area. Some fluids may remain and you may leak a little from the incision sites during the first day or two after surgery. This is normal. What changes happen to my body? The stomach is made much smaller by stapling and separating the stomach long ways, making the new tube-like stomach approximately the size and shape of a banana. The size will be approximately 3 ounces in volume. The remaining stomach, approximately 80 to 85% of your original size, is removed after the stapling and separation. This is not reversible. The small intestine is divided below the stomach at the beginning of the small bowel. The valve that releases food to the small intestine is left along with the first part of the small intestine. The surgeon closes off the middle section of the intestine and attaches the last part of the intestine to the first part of the small intestine mentioned above. The separated middle section isn't removed, but instead is reattached to the end of the intestine so that bile and other digestive juices flow into the last part where it will finally mix with food. This bile and digestive juices meets up with the food late in the digestion process. Decreased size of the stomach, bypassing much of the small bowel, and bile and digestive juices meeting up with food late in the digestion process all contributes to weight loss by decreasing calorie intake and absorption. The staples are made of titanium, which means that you may have MRIs or go through metal detectors without a problem. The gallbladder is removed with this procedure. Will I need a drain? A drain may need to be placed. If you have a drain, it will be removed before discharge from the hospital or at your first follow-up appointment.